All right. Good evening and welcome. Assalamu alaikum, everyone. On behalf of the Surgery Interest Group, I'm so happy to have you all here with us. My name is Lotus Maroof, a current third-year medical student and the co-head, along with Rafa Shaheen, of the Training and Development team, and I'll be your host for today. I'm really excited to share this talk with you guys today because it's one of our talks from the Pathway to Excellence series, and it's something new. And our doctor today will be introducing us to how to ace the postgraduate year. It's especially exciting because it's a stage that addresses something medical students really suffer with and interns look forward to. So, uh, if you feel any uncertainties, this talk is for you. So, whether you're planning a gap year or you want to strengthen your CV, you want to navigate applications, or simply you're just figuring out what to do with the next step after graduation, postgraduate years can feel intimidating and exciting, but overwhelming. So this is our job for today. We're truly honored to be joined with our doctor today, or our speaker today, Dr. Nour Odeh, an incoming R1 in surgery at John Hopkins Medicine, mashallah. Dr. Noor will be sharing her expertise and insight and advice on navigating this important transition from medical school into the postgraduate year into residency, inshallah. Please give a warm welcome to our doctor.
Thank you, Lotus, for this great introduction. Hi, everyone. My name is Nour Odeh, and I'm actually very happy to see two women leading one of the groups in Surgery Interest Group. I was actually one of the people who started Surgery Interest Group, so this is very, very nice to see. We were only three women when we started. So Lotus and Rafa, this is very nice to see. Congratulations. So today I'll be talking about acing the postgraduate year. And a little for those who don't know me, my journey basically started in Jordan. I graduated my high school from Jordan at Mashriq School. And then I moved to Riyadh because my dad worked there from 2018 to 2024, where I graduated from Alfaisal. And then I did my electives in the United States. I did 4 months of clinical electives during my intern year in surgery. And then I was accepted into a research fellowship in thoracic surgery at Mayo Clinic, Arizona, where I am right now. I started in August 2024, and until now, I am in that position. And thankfully, I applied for the match in September of 2025 for the first time for general surgery, and I got accepted in March of 2026 at Johns Hopkins, alhamdulillah. And I'll be starting in July, actually in June 8th, my orientation at Johns Hopkins in Baltimore. So this is briefly my journey and what I did. So what is a postgraduate gap year in medicine? I'd like to make this a bit interactive. What do you guys think it is, and what do you think you can do in that year after graduating?
You can work as a TA.
Okay, yeah. So a lot of people actually work as a TA. A lot of my friends did. It's a good chance for you to gain money, first of all, and it's a good chance for you to keep like the education running. You'll keep your information fresh, and you'll meet like a lot of students. You'll be able to teach them. So TA is also a very common thing that people do. Another thing that I personally chose to do is taking a year off and doing research. And this is not everyone chooses to do that path, and every path has its own positives and negatives. So some people choose to do a research fellowship to basically gain research experience, increase their publications, make connections in the United States, and basically be able to apply for a residency with those connections. Another option is to do clinical work, where basically you do service residency. One of my friends did service residency in Shmesi in plastic surgery. A lot of times it's unpaid, a lot of times it's only for Saudis. So this is also some negatives. You can also be a GP or a general practitioner in Saudi. And this one positive of that is that it gives you like some clinical experience, which is important. And another one that we already talked about is being a TA at Alfaisal University. And some people choose to do a master's degree. So what I chose to do was a research fellowship in thoracic surgery, which is one of my interests, thoracic surgery, and I did it at Mayo Clinic, Arizona. So the question is, since that's what I did and that's what I will be most capable talking about, how to land a research fellowship in surgery, and especially in the United States. We all know surgery is a competitive field, and that's why we're here in this talk. And landing a research fellowship can be tricky. To land a research fellowship, you need to understand what general surgery programs look for. They not only look for research, and that's an important thing to understand. They look for someone that is very well-rounded. Do they have extracurriculars and leadership experiences? So they want you someone that is part of interest groups, and this is why surgery interest group exists. They want you part of MSA. They want you part of sport activities. They want you part of leadership, like, for example, head of a group, or a subhead in a surgery interest group like Rafa and Lotus. They would ask you about like your experiences in the United States, for example, like clinical electives, which you do in your internship year. They would ask you about your research in your application. So research publications, research abstracts, conferences you attended. So all of this adds up. Once you land an interview in general surgery, then your interview performance also matters, your personality, how you come across, how you talk to people, how you interact, how you ask questions. And then this is how I'm trying to deliver the message, is that it's an overall picture. It's not just research, and it's not just grades, and it's not just your experiences. It's all in all. So when you try to land a research fellowship in surgery, understanding all of that is very important. And your mindset matters when you're looking for a research fellowship. You need to be open-minded, whether it's paid or unpaid. I personally started as an unpaid position, and I was lucky enough to get paid after 8 months. This is not a common path. Not everyone gets paid. I know people who spend 2 years in research in the United States unpaid. And for you to actually gain the experience and add it to your CV and strengthen your research, I think you need to be open-minded. As much as it sucks, as much as you need to be open-minded for unpaid positions, you need to be open for any specialty. So some people with me are not necessarily interested in thoracic surgery per se, but they chose to take that because that was the opportunity that they got. I personally like thoracic surgery, but if, like, let's say you find something in transplant surgery, I would say if it was your only chance, go for it. You need to be open to clinical versus lab, but my personal opinion would be to stick to clinical because it's a bit faster to publish in. You could do retrospective, you could do different types of research, where in 1 year you could publish a lot of research more than basic lab. Basic lab would be you're working maybe with mice, with pipettes and everything, and you would take at least 1 year to get like 2 papers out. If anyone has any questions throughout, or you feel like you don't understand certain points, please feel free to interrupt me and let me know. So Sarah asked me, does choosing different pathway vary according to what subspecialty you are interested in? Well, I would say I'm most experienced in talking about research fellowships, but depending on what you like, the more competitive the specialty is, the more being in the US and knowing more people matters. So let's say you're interested in orthopedic surgery, and orthopedic surgery is one of the probably most competitive surgical subspecialties, and people apply to it directly. So I would say going to the US and being in a research fellowship with people in ortho who know people and will be able to connect you to those people really matters. So I would say that is superior to like being a TA, because being a TA would keep you in Saudi Arabia, would keep you in Alfaisal. It won't really expand your connection network, if that makes sense. All right, so how to find and secure a research fellowship? Basically, you need to understand that people at Alfaisal are very helpful. your seniors are people that you need to reach out to, and don't hesitate to always ask them questions. I personally was able to land my research fellowship. I did multiple things, but what landed me this research fellowship was I talked to Kinan. He was Kinan Shawaf. He was a research fellow in my team before me, and I knew that he matched into a prelim position in surgery. So I reached out to him because I knew his spot freed up, and he basically connected me with his PI, Dr. Don Jarosowski, and I interviewed with them and got the position. So don't hesitate to always reach out to your seniors. You never know. I didn't know Kinan personally, and he still helped me out when he saw my CV. And so you wouldn't be able to know who will actually help you. So reach out to everyone. And use social media. I personally use my Twitter, or X, how they call it now, as my LinkedIn, where I post my accomplishments, I post everything, and I network with people in medicine and surgery. And actually, people say sometimes it's useless, but when I go to conferences, I meet people through my Twitter. And during my search for research fellowships, I was able to reach out to a lot of surgeons who actually replied to me. Some of them had positions, some of them didn't. And at the end, I chose the one I'm at right now. And timing is everything. As I mentioned earlier, I chose a time when people matched. So you need to be very, very smart about this. You need to see okay, who matched and what positions are freeing up. So who do I need to reach out to, and when do I need to reach out to them? Ask during clinical electives. So during my clinical electives, I was also able to get a position at Cleveland Clinic with my doctor, Dr. Crow. He was a bariatric surgeon under the general surgery department. So during your electives, ask for research opportunities. If you like the PI and if you like the attending you're working with, be like, hi, I really enjoyed my rotation with you. Do you think you have a position for research for me? I'm interested in taking a year off to strengthen my application and see how they react. They might have a position, and they might not have a position and know of an attending that they would recommend. Be proactive and persistent, and this is the best advice I could give anyone, especially in med school. We sometimes are careful. We're not we're not very proactive. We're scared to ask questions. We're scared of being annoying, but you need to be smart on how you approach things. Try to have that thin line and be able to read the room of when you're being too persistent and when you're being respectful but persistent. So try to follow up with the people you reach out to. Sometimes genuinely people forget, they're really busy. Sometimes I miss messages, and when people remind me, I actually reply to them. So be proactive, persistent, follow up with the people you reach out to, and show them that you're genuinely interested. With that being said, I would tell you how to write an email or a message to someone who you're reaching out to with an interest for a research fellowship. You would start by introducing yourself, attach your CV. Please build a really nice, organized CV. Introduce yourself in the email or message. Say when you graduated or when you're graduating. Say if you have any clinical experience in the US. Say your interest, what subspecialty, and make sure if you're reaching out to, let's say, a thoracic surgeon, to say that you're interested in thoracic surgery. Do not make yourself look confused. And maybe attach your number. Tell them that you're open to paid or unpaid. Tell them that you're open to come anytime. So try to make it very flexible, and try to introduce yourself in a comprehensive and cohesive way in your email. Okay. Doing a research year, what are the advantages and disadvantages? So let's say you landed a research position. The advantages are you're going to be situated in the US. And honestly speaking, I'm going to be completely transparent. For me, being in the United States while applying for general surgery residency was very helpful. Why? Because right now there are some visa issues. When they know you're outside of the US and you have kind of a passport that would cause hindrance, they don't even send you an interview. So thankfully, alhamdulillah, with God's like grace, I was able to get interviews. I was able to do well on my interviews, and I was able to land um, a position. And of course, guys, this is all because of Allah. And first and foremost, we can do whatever we want, and if God doesn't want anything to happen, it will never happen. So keep that in mind, and you will go places. So you'll be situated in the US. You'll have stronger connections and letters. So unfortunately, the letters from the United States, if you're applying for residency here, matter more than the letters from, let's say, Saudi. Okay, so if you're here for, let's say, your clinical electives, and you have letters for 1 month, so you do 1 month of clinical elective, and then another month, and you get letters from those people. So having a letter from research here kind of anchors the fact that you are a good person to work with, because the ones you worked with in the clinical elective was for 1 month, but then the ones you worked with in the research year was for a year or more. So mine was for like a year and a half. So the letter from them actually like held a huge weight. And that word from them holds a weight in programs, and they recognize names, they recognize that these are people in the US, and they would give you an interview and respect you more. You can benefit from your PI's network. So the more well-connected your PI is basically the person you work with research and your mentor. The more well-connected your PI is, the better it is for you, because they'll be able to call people for you, call attendings, basically like email program directors, and tell them, listen, this person is good, I worked with them, and I really recommend them. You can go to conferences with your PI, which I highly recommend, and they could like introduce you to PDs, introduce you to attendings. With that being said, you could also go to conferences on your own, which I did. I went to ACS, American College of Surgeons, which is one of the biggest conferences for surgery. And I was able to meet so many people. You would like sit on dinner tables with huge attendings and network with them and connect with them on a personal level. And my advice is to actually create meaningful connections with those people. Connect with them on a personal level before professional. Other goals, I would say, use the time to focus on goals like step 2 and strengthen your application during this year. So actually, the reason I took a research year or a gap year was to do my step 2, because during my electives, I did my electives early and I pushed my step 2. So I was not able to apply for the 2025 cycle. So it depends on your personal goals. Do you want to do your step 2 or do you want to do your step 3? And don't leave a gap that's empty. Try to like fill it with a research year, a TA job, anything that you think is suitable for you. The disadvantages, as I mentioned earlier, is that it's often unpaid, there are long hours, and you're often overworked. A lot of the big institutions, they use the research fellows because they know that we need those opportunities, we need those publications. So if you're not like firm and like you know your boundaries, sometimes you can be overworked and not paid. Your work is not always appreciated, unfortunately. Your work sometimes goes unrecognized, and attendings or like people in higher positions in the department are going to take the credit for your work. And that gets tricky, honestly, sometimes, but you have to weigh it and try to be smart about it. Moving to the US can be hard. I moved on my own. I was lucky enough to find a community where I moved with a friend of mine. I found the Muslim Arab communities. I found friends, but that is not always the case. And I know people who were very lonely in the US. Moving on your own can be difficult, especially if you don't have like a credit score. Getting an apartment is hard. Getting a car is hard and expensive. So all of these things you need to take into account, and you need to ask people who've done it before if you're taking that step. And that's what I did, and I took their advice. Is it all clear until now? Does anyone have any questions? All right. So how to be productive? So first of all, I would say during your research year, being productive is very important. You need to be organized in your work. What I did was I had an Excel sheet with all the projects that I am working on, even if I'm not leading that project. And that's an Excel sheet for myself. Like I didn't share it with my PI, I didn't share it with anyone. And I would put all the projects that I'm working in, whether with my mentor or other people, and I would put the progress that I'm at. So that when someone comes and asks me, do you want to work on this project? I would go to that Excel sheet and I would be like, I have a lot of projects that are still like ongoing and I don't want to overwhelm myself. So let's say I'll say no this time and tell them I'm a bit overwhelmed with work. So stay organized so you know what you're working on. Know your bandwidth. And as I said earlier, don't say yes to everything. And that's why having an Excel sheet is so important. Know how much you can push yourself. Having like 100 projects and none of them done is worse than having one done project. And that people usually understand very later on in their career. So understand that when you go into your research year, and understand that basically me finishing a project from A to Z shows that I'm able to bring things to the finish line, while me having 100 projects or 100 abstracts on my application is a red flag, where people are going to be like, oh, they have 100 abstracts and no manuscripts done or published. So that's like someone that cannot finish things. So be very careful. Work on your weaknesses. So one of my weaknesses was statistical analysis, and I was able to learn on SPSS. I was able to use my colleagues to teach me to basically increase my skills. I also learned a lot of things like how to conduct a survey from scratch with like a survey center at a big institution at Mayo Clinic, how to do certain designs that I was not comfortable with before, like perspective studies. So Sarah is asking, do research projects from Saudi benefit your application? Yes, so actually, I was very active in research in Saudi. So that helped me work on my weaknesses, which is a perfect timing for this. I went to my research year knowing how to write manuscripts, knowing how to data collect, knowing how to work within a team in a research project, knowing how to lead a project, knowing how to basically talk to the journals and submit research and be able to publish it. Those projects that I worked on in Saudi were not necessarily all surgery, and that's why it's important to be part of projects even if they're not in your field of interest, because it helps you build those skills. So be part of projects because they help you. But I know a lot of people, one of my closest friends was never like active in research in Saudi, and she was able to learn everything from scratch in the United States, and that actually like shows that you're able to push yourself. So don't worry if you don't have that much research experience, you can build it. Work on big and small projects during your research year. Don't focus only on large projects. This is going to be the end of you. If you only focus on big databases, you're going to spend all your research year data collecting. And by the time you reach your application submission for residency, you won't have any time. You won't have like any time to publish. So try to work on big and small projects to publish, like reviews, big databases, as well as other like case reports, retrospective studies, and everything. Work well with everyone. Please do not have any issues with anyone. PIs and mentors are able to pick up on that very easily. Be someone easy to work with, someone smiley and doesn't complain and is willing to help people. You are not in competition with the people that are applying with you in the same cycle. Once you get that out of your head, you're able to focus on actually what matters. I was applying with my colleague Amjad. We were applying to the same cycle. We were actually helping each other with research. We were helping each other with the application. So don't be that competitive person that no one likes. Expand and work more with more than one mentor, and that is an advice that can be a bit controversial. Not everyone would agree with me, but I would say you're there with yourself as the number one priority. I know that your PI would probably not like you working with other people, but if your PI or your mentor is not very active in research, or is active in research, but your projects are taking a while to get published, then I would advise you to also work on other projects with your friends, with other mentors, and try to like expand your network. Build a competitive CV, work on abstracts to submit to conferences. Make sure you transform those abstracts into manuscripts and publish them so that you look like a person who can finish things. Attend conferences and meet people. Stay active. People underestimate how important that is. Stay active for your mental health. Join groups like pickleball groups, running groups, whatever you're interested in, chess, whatever. Finish your step 2 and get a good score if you can. And please do not think that if you are applying for surgery, you need 270 plus. I have an average score, and all the people I know who applied and got into surgery have average scores. And by average, I mean like 240 to 250. So as long as, even if you get a score in the 230s, you can still get into surgery. So do not let that like toxic mindset of grades and being a straight A student, that doesn't always like guarantee you a spot. Do step 3 if you can, and get strong clinical and research recommendation letters for your application. Thank you guys for your time. I hope I covered everything. I tried as much as I could. If you have any questions, I would be happy to answer them. And I am writing my email on the chat and my number to in case anyone wants to ask me anything that I didn't cover and they would feel more comfortable asking me in like a more one-on-one fashion. Would a high step 2 score cover up for deficiencies in research, other aspects of the CV? So Abdurrahman asked that on the chat, and I think as I said, it's like they look at you as a package. So let's say you have a low step 2 score, and then a lot of research, a lot of extracurriculars, a lot of clinical electives, really good letters, then that would cover up for your low step 2 score. If you have a really high step 2 score, it might cover up for other aspects or other deficiencies. But what would look best, in my opinion, and a lot of people I talk to, is that having like an average score, like let's say 245, okay? And that's just a score I made up. Like let's say 245. It shows that you're really good in test taking, you're really good in like managing your time and everything, but you also have, you're also part of a running club, you're also head of surgery interest group, you're also have a research year, you have like 15 publications, 14 conferences, and you know, this person would look like a better candidate in their eyes. So I hope I answered your question, Abdurrahman. Muhammad is asking me, have you finished step 3? This is a very sensitive question. I'm actually in the process of studying for it. My orientation starts very early compared to other programs, so I'll try to maybe get it out of the way. I was studying during my research year and a half. I was studying for step 2. So I did my step 2 in July 5 of 2025, and then I applied for the match. So I was kind of burnt out from all the work and studying that I was doing. So if I could advise you, is to finish step 2 before going to your research year, and then you'll have more energy to finish step 3 during your research year. So now I'm trying to finish my step 3. How to get a paid research fellowship, and could you explain other things I can do during my gap year if you know anything, especially in the US? How to get a paid research fellowship, you need to be smart about choosing the research fellowship. So when I chose my research fellowship, I had multiple options. As I said, I had an opportunity from Cleveland, I had an opportunity from MGH, I had an opportunity from Mayo Clinic, Arizona, and an opportunity from Mayo Clinic, Rochester. I chose Mayo Clinic, Arizona, because my PI told me it's going to be unpaid, but she had funding. So search for a PI or a mentor that has funding, whether it's NIH funding, personal funds. So you can ask those questions in the interview or in the email that you're sending. So try to find someone with funding so that even if you start unpaid, you could move to a paid position later on. you can do during your gap year if you know anything, especially in the US. Other things you can do in the US, you could be like a medical assistant, or other things you can do, research assistant in a lab. That's all I know, honestly. Apologies, the thing I did was research fellowship, so that's the thing I know most about. Sorry, I asked you about step 3. I was asking if it's important to match in competitive fields. No worries, I was joking. It's not important. It can. Some people say it helps because we're IMGs for the visa if you're applying for H-1B. But for me, all the programs I interviewed at for general surgery did not have. They did not even sponsor H-1B. So that's why I was kind of like, I'll do step 3 later on. Like I just wanted to do it before I start my residency. Yeah, so I hope that answers your question, Mohammed. Tasneem is asking, do you get to see patients scrub in during a clinical research fellowship? This is a very, very good question. So you can aim to ask that in your interviews with people when you're applying for research fellowships. You cannot scrub in. So this is a given. You cannot scrub in because when you're going to a research fellowship, you're on J1 research, which is different than J1 clinical. J1 research can have patient contact, but it's minimal. So you can see patients with your mentor if they allow you. And I see patients with my mentor, but it's specific to practice because I do practice research. And I go to the OR, especially when I'm doing a paper that's specific on that patient, where I take pictures, I understand how the surgery went so that I could write the paper in a better way. With that being said, not all mentors or PIs or attendings allow you to go to the OR, and not all institutions. So I think that's a very important thing that you need to be doing to stay in touch with the OR, to stay in touch with the field, to know how to read the room, to stay on top of things, you know? So ask that in your interview, or the seniors that were in your position before. Abdurrahman is okay. Thank you. Welcome. Sarah Idris, how is the environment there with women in surgery? That's a good question. So my mentor is a woman, Dr. Dawn Jarzowski. Thankfully, this is one of the things I'm thankful for, because thoracic surgery, women are very, very few in thoracic surgery. But I was lucky. Women in surgery in the US, it's better than Saudi, and that's unfortunate. I know Saudi is getting better and Arab countries are getting better with that. But in the US, you don't feel the discrimination as much. People motivate you. Even in my personal statement, when I applied for general surgery, I wrote that being a woman in surgery was tough, coming from a conservative environment. I wasn't always supported, but that gives you more motive to actually apply and create that environment. Now when women reach out to me, females in medicine, they reach out to me, I try to help them, because I personally did not see that support, because there weren't a lot of women in surgery when I was applying, or when I was searching for research fellowships from our university. How many papers in average are we talking about with a research fellowship? This is a very good question, Sarah. So this really varies. I can't give you a number. I could tell you, I know people who were able to publish 5 papers and go to 100 conferences and actually have so many abstracts and meet so many people during conferences, and that depends on your PI. My PI doesn't really love conferences. She prefers publishing. So I was able to publish 15 papers and work on 30 projects. I was able to go to maybe 4 conferences and maybe have 15 abstracts accepted in total. So it really depends on the mentor you choose. I have a friend, she chose a mentor that really cares about conferences. So she has maybe 5 publications with him, and a lot of conferences. And in conferences, you meet so many people. So it depends on who you choose and how you play your cards. Let me see. Tasneem is asking. Okay, thank you. Muhammad, could you explain more about your research? What was your research type? Okay, and how did you? Okay, so Muhammad is asking really good questions. So more about my research. My research is thoracic surgery, and I would advise you to choose something very niche. What I chose was my doctor, Dr. Dawn Jarsowski. She's a thoracic surgeon. She does chest wall, specifically pectus excavatum. Pectus excavatum is when the chest is deformed and has like an indentation in the middle. And in the world and in the United States, they say that this is a more cosmetic deformity, and people don't always do surgery for them. But she proves with her research that basically they have cardiac compression, they have shortness of breath, they have so many symptoms that are overlooked. And once we put bars in them, we put like 3 to 4 bars in their chest for 3 years, and then we remove them to push the deformity up. Once we do that, their symptoms improve, their quality of life improves, and their symptoms that were always dismissed are actually gone. Their exercise activity improves. We do something called cardiopulmonary exercise testing. We do tests like intrathoracic echo in the OR, basically transthoracic and transesophageal before and after. We do surveys before and after for their symptoms. So choose a niche topic, someone who is doing something that actually changes practice. I was able to do, to answer your question about what type of research papers I was able to publish, I did a lot of retrospective studies. I did a lot of, like, for example, looking at infection rates in 1,500 patients. My doctor was able to do 1,500 patients in 15 years. So that's huge. Choose someone impactful, choose someone that is changing the practice. I was able to write guidelines. I was able to write systematic reviews, retrospective, again, case reports, reviews. So I did a bit of everything. RCTs, unfortunately, we did not work on any randomized control trials. It needs a lot of money, and usually like clinical fellows or attendings work on RCTs. How to apply for research fellowships, any specific application or cold email to a doc works. Okay. How to apply, I told you, like, let me go back to the how to apply. You need to be open-minded, reach out to people, whether on Twitter, have a message that is like a controlled message and send it to everyone. Make sure you change the names on Twitter, on emails, find emails on PubMed, find your seniors, as I said, who have already matched if their positions are emptied, and reach out to everyone, whether on WhatsApp, on Twitter, on emails. I found emails through PubMed, through publications. I found emails through, like, for example, I went to a conference and they put their email, so I reached out to them if I found them interesting. And I asked around, you know. Muhammad, you can reach out to me and I can send you an example of an email that I sent. Rashira, I'm not sure if this was asked previously. Is there a number of publications needed that interviews look for to get a research fellowship, or it depends on the PI alone? Okay. So, very good question, Rashira. There is not a specific number of publications. I know people who were accepted with 0 publications just because they liked their personality. And I know I went in with, like, I think I had 7 publications and maybe 5 submitted before I went into my research fellowship. So it goes either way. And if one thing works for one person, it might not work for another. And I want to take this moment to share that God has his way of working things out. There is not one single pathway, guys. You can make things work in many ways. I was able to land a lot of interviews, alhamdulillah, for my general surgery application, but I did not match during the match, and I was able to match into Johns Hopkins through the SOAP, which is after the match cycle. So it's not one way how things work, and you need to understand that going in, because it helps you be like very motivated, because you can do things differently and end up where you want to end up. What's the difference between research fellowship and a research assistant? Research assistant is usually in a lab where you like help them do ELISA, help them do certain things in the lab. It's mainly basic research. Research fellowship is usually a clinical research fellowship where you work in a computer. Yas is asking, how would someone know that they need a research gap year given that they already have step 1, step 2 as a non-US IMG, and by what amount would a research gap year increase the matching chances in a competitive program like surgery? Very good question. Yas, can I ask you, where are you from? Okay, so being Syrian and having a passport that actually right now, like the ban and everything, I would highly recommend that you come as a research fellow. So this is to answer your question. You have step 1, you have step 2, but you have a Syrian passport. So a lot of people I know were not able to match because they're outside of the US and have a passport that is on the ban list. So if you try to come to the US as a research fellow to overcome that barrier, then inshallah, hopefully you will have a higher chance of matching. I have a Syrian friend who matched into internal medicine, and internal medicine is quite competitive these days. And she's Syrian, but because she's in the United States, they overcame that overcame that fact, you know. So that would be useful to you in that sense. You could also take a research gap year to strengthen your CV. Like if you have step 1 and step 2, but let's say you got an average score and you want to increase your research experience, that would be helpful for you. You want to increase your networking. Let's say you didn't do clinical electives, okay? You want to increase your networking, so that could also be useful. So like getting a J1 research visa is easier, right? Yes, getting a J1 research might be possible. And then in the US, you would, once you get accepted, inshallah, for residency, you would do a category, they call it change of category, where you switch from J1 research to J1 clinical. So you don't have to go out of the US and come back, if that makes sense. Thank you so much. Welcome. Okay, let me see other questions. So proud of you for making it there. Thank you for this insightful talk. Welcome, Sarah. Hopefully you guys are going to be next. Can you explain point 3? Timing is everything. Also, how did you change unpaid to paid? Okay. Yeah, sorry, I missed that question. I'm going to answer you now. Point 3, timing is everything. So timing is everything. What I meant by that is that let's say people reach out to me now, okay? Now I already filled out the positions of the people that are like going to come after me, okay, in my team. So that makes it a bad timing for people to reach out to me now. Why is that important? You need to reach out when I first matched. So let's say in March, people reached out to me. I was able to give them an interview and connect them with my mentor. So try to reach out to people in March when they matched, when their positions freed up. How did you change unpaid to paid? As I said, I chose a mentor that has funding, but I went with the mentality that I don't know. So a little bit of background, you never know, like the circumstances have to line up, have to align with you getting paid. What I mean by that is that I was with 3 other people in my team, and it was not guaranteed that I would get paid. So what happened was my attending had funding, and the 3 people I was with, all of them, they matched into surgery. So I was the only one left with the most experience compared to the people that are going to come like newcomers. So that's why I was lucky, alhamdulillah. My PI had funding and the circumstances aligned with me getting paid. With that being said, please do not have a closed mind in terms of it could have been that I wasn't going to get paid. And I know people who spent 2 years in the US unpaid. So you need to go with that mindset that whatever happens, your end goal is not getting paid. Of course, money is great. Getting paid for your efforts, you feel recognized for your work. But our end goal is not being researchers. Our end goal is being clinicians and matching into general surgery. So if you have that mindset, then you're going to feel lighter because, okay, I'm going there to make the most out of this, to match into residency, and hopefully, or maybe I'll get paid. Does that make sense? So of course, I expressed to my mentor that I would prefer getting paid, but also the circumstances worked, and I chose a PI that has funding. What is SOAP program and how to still have hope in matching with that program? So Sarah, people who apply for the match, so I got 7 interviews, which alhamdulillah was a great number, but sometimes things go wrong. I also did well on my interviews and everything. SOAP is basically the moment you get your match result, you have a chance to apply to other programs that still have unfilled spots. So I put my all into SOAP during the match. Like my friends helped me. I'm very grateful for that. We like sat together, saw the programs that accept visas and applied. And then I got calls. They call you, the PDs, if your CV is good, if you have a good application, if your mentors vouch for you, and they interview you and they match you. So it's in the match cycle. It's the match process. But the moment you get the match email and they tell you you don't match, you have a chance to SOAP. Okay, welcome. Iyas is saying, can we get your contacts? Thank you so much for this info. So I'm gonna type, I don't know why my contact information disappeared, but I'm gonna type it again. So I'm typing my email, my personal email, my Mayo email, mayo.edu, and my phone number. So please reach out to me with any questions. I might be slow with answering because I'm moving from Arizona to Baltimore soon, so it's a little bit hectic. Nour is asking, thank you, Nour. She's not asking, okay. What is the best way to secure a postdoc research position as an IMG? So Haya, as I said earlier, the best way is to reach out to your seniors first. If that doesn't work out, reach out to the people that matched, whether they posted their match on Twitter, on I don't know where. So reach out to them and email attendings. You can get their emails through PubMed, through papers, and ask around. Don't be afraid to ask around, especially now a lot of research positions are opening. Still didn't understand timing. Can you explain again? Okay. So Muhammad, if you reach out to people now, which is in May 10, let's say you reach out to me now, asking for a research position in my team, I would tell you we don't have any openings. If you reached out to me in March of 2026, I would tell you, okay, and I would secure you an interview with my mentor. Why? Because when I first matched, my position emptied. And we had openings for people to come in, so we started interviewing them. So that's what I mean by timing matters. What did you do different in SOAP that made you match? Honestly, I didn't do anything differently. Sometimes it's all about luck and it's all about God's will. I did very well in my interviews in the match cycle. And I got very good feedback from all the attendings and everything. But sometimes God has a different plan for you. I did the exact, my exact same CV was in SOAP, my exact same personality, but things happen. And that's why I try to tell you guys that things happen and it's okay. And people have different paths. And if you take that path, doesn't mean you're any less. بالعكس, God يعني wanted something even better for me, alhamdulillah. The program I ended up matching at was better than all of the programs I had. يعني I had, alhamdulillah, very, very good programs. But things happen, and that's يعني an important mindset to have when you're applying for the match. I'm sorry if I missed this, if you've already answered, but do you think we should try securing research fellowships in the same hospital with... Very good question, Rawad. So definitely, I would tell you that being in a research position in a hospital for 2 years or a year and a half, like me, would increase your chance of matching there. But I would tell you, I ranked Mayo Arizona first. I'm trying to be as transparent as possible, okay? I ranked Mayo Arizona first, and I spent a year and a half there. I got an interview there, and I got an interview at Mayo Rochester as well. But I did not match in Mayo Arizona, even though I ranked them first. And even though I'm not trying to be like شايفة حالي, but my CV could get me into Mayo Arizona. But things happen. I was working with thoracic surgery. I was not working with the general surgery department. So thoracic surgery is kind of split. So that's also something you need to consider. So if you want to match at that institution, maybe aim to work in the general surgery department, not like a subspecialty, not ortho, not thoracic, you know. That's an advice I could give you. And also, nothing is guaranteed. You could spend 4 years in a research position at an institution and match somewhere else, and that's completely fine, Rawad. Like, honestly, I'm very happy with where I matched. Alhamdulillah, I could not be more thankful to God. Yani, alhamdulillah. So things work out. Even if you don't match at the same institution you're at, it's okay. It's not, and it's not guaranteed. Like, you could spend so much time working. I spent all weekends working at Mayo, day and night, so many publications, so many conferences, and I didn't match there, and that's okay, alhamdulillah. So have that mindset and you'll be okay. I hope I answered your question. Thank you, Rashira. Thank you all. Seriously, you guys, I hope you all match, and whenever you need anything, I hope I'll be able to help you. You mean the research fellowship is also like a matching process? That's why timing is important. Kind of like when people who are in research fellowships, so when you reach out to a research fellow that matched, then you can fill their spot. So care about the timing of when you reach out, align that with the match process. Do you understand what I'm saying? I feel like I confused Muhammad more. All right, welcome. Like, reach out to research fellows that matched in March. I think that simplifies things. There are so many talks for a good step 2 score. You said it still works out. Can you explain more? Yes, actually, this is a very, very important point. I had a friend who really, 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 really got upset about their step 2 score because they scored low. And they were like, my surgery career is over. I'm not going to be able to match. I'm not going to be able to get interviews. That friend still got really good interviews and still matched. So my point is, if you hope and aim for a good step 2 score. And when I say good, I mean 240 plus, okay? Don't like, it's not necessarily that a good step 2 score is 270. But we have that toxic mindset, and especially in Alfaisal, sorry guys, that we have to be straight A students and get a 280 step 2 score and be the first on your class. And that's not what makes the best surgeon or the best doctor, in my personal opinion. What makes a good surgeon or a good surgery, like someone who's like on an elective or in the research, is how you talk to people. If you're able to read the room, if you're respectful and you work well with everyone, if your work is good, no one is gonna care about your step 2 score. I had my step 2 exam. The next day I came to work and no one asked. And when my step 2 score came out, even my mentor did not ask me about my step 2 score, even though I did my step 2 while being there. So what I'm trying to tell you is, get a good step 2 score. But if you don't get something good, like let's say you get a 230, that doesn't mean that you're not going to match. Still try to do your best. Still try to work on your CV, on yourself, on publications, on being a well-rounded candidate, and hopefully you will get good interviews. I had an average step 2 score in the 240s, just for transparency, and I got 7 interviews, all from top institutions. So, and I'm not saying this to show myself. I'm just trying to give hope for everyone that it's fine. Everyone has their own path. Some people who got 270 matched, some people who got 230 matched. So it's okay. Everyone has their own path. Thank you so much for your client. Congratulations once again. Hopefully you guys will match and you'll be the next generation. And if you need anything, please feel free to reach out to me on my personal email, my Mayo email, and my number. I might be slow because I'm moving, but let me know if I can help with anything. And good luck to everyone. And hopefully you guys are going to be next.
Okay, once again, congratulations, Dr. Noor, on your match. MashaAllah. Hopefully, we can learn from you, and soon it's us that's matching and working with you directly حتى in clinical experience. Thank you, everyone, for joining us, and a special thank you again to Dr. Nour Odeh, backbone of SIG and advocate for women in surgery. It was such an inspirational and insightful talk. We truly hope everyone today had a clearer perspective on navigating the postgraduate year, and hopefully this talk helped answer some of your uncertainties regarding this stage of the journey. Thank you all so much, and we hope you have a great evening.
Thank you for organizing this.
Thank you so much, Dr. Nour. يعطيك العافية.
الله يعافيك. Bye bye.